For the next portion of my head to toe assessment, I'm going to first start by assessing my patient's Glasgow Coma Scale rating. For this assessment, we're checking for spontaneous eye opening and a motor response and a verbal response. So I can see that Adriana is looking at me, she's blinking her eyes spontaneously. If I were to ask her to move her arm, she would be able to do that, so she's able to respond to verbal commands, and then she's also able to verbally respond to me if I were to ask her questions. So right now I would say that Adriana has a 15 on the Glasgow Coma Scale. A few more things to be aware of with the Glasgow Coma Scale. If you had a patient that had a neurological issue or some sort of brain injury, it would also be good to assess for decerebate or decorticate positioning, which would be either abnormal extension or abnormal flexion. So in a few minutes, I'm going to next be listening to your heart and lung sounds and your vowel sounds, but first off, I'm going to be checking your pupils to see if they're equal and reactive to light. So I'm going to use my little pen light here real quick, and I'm just going to take the light and flash it in your eyes to see if your pupils are reacting. Perfect. They look good. They are perla. So, as I stated before, when I was looking at her eyes in the general survey, I was checking for any redness of the sclera or any drainage. I didn't see anything. Next, I would be checking her scalp for any abnormalities or anything. I'm going to quickly run my hands through your hair just to see if you have any like masses or anything. Your hair texture feels good. I don't feel anything abnormal. So next I would be going through the pulses. I'm going to do all 8 pulses right now. So the first pulse that we assess in a head to toe assessment is the temporal pulse, which is right here by the temples, and I would feel this. I can feel them if they're present. And next I would go through and I would be checking the carotid pulse, and you have to do each of those. It's right on your neck, sorry if it tickles. I can feel it, so you have to do that one for a full minute, and you do them individually so you don't cut off circulation. Good, I can feel those, they're present. The next one will be the brachial pulse, which is here on the arm. For the purpose of this assessment video, I'm not going to roll up her sleeve. I'm just going to act out feeling where the pulse is. So it's there, and then it would be on this side as well. And we'd feel around where the bicep is. Next, we would feel for the radial pulses, which are on the thumb side of the wrist. Sometimes you can check for ulnar pulses as well, but they're usually not very present in many people. So I would check this one as well. Wonderful. All equal, and they're not bounding. They all feel regular. Next, I would be checking her popliteal pulses, which is behind the knee. Again, I'm sorry if this tickles. We're just going to check her here real quick. Perfect. I can feel that one. I can also feel this one. And next, I will be checking the posterior tibialis pulse as well on her foot. And then on the other side. And then I'd also be checking the dorsalis pedis right here and also here on this side. And for the purpose of this exam, I know we cannot see her feet, but I would also be assessing her feet and all of her extremities for circulation, sensation, motor function, and temperature, and capillary refill. So I would quickly pinch her skin and assess if she has good perfusion. If it's any longer than 3 seconds, then she may have a perfusion issue. If the skin goes back to normal color after 2 seconds, then everything is okay. I would also be checking to see if she has any abnormalities in hair distribution on her legs or any edema or swelling. While I'm here, could you push on my hand with your foot like a gas pedal? Perfect, perfect, and with the other one as well. So right now I'm also, so she has good foot flexion, and would you be able to move your leg, like kick your foot out? In the other one too? Good. So she can do active range of motion. If I wanted to, I could do passive range of motion where I do it for you. So all those pulses are good. I can do, can you squeeze my hand? In this one too? Just want to make sure they're equal.
At the same time?
Yeah. Good. Good, good, good. Very good. And could you close your eyes and then stick your hands out and just try and keep them even. Good. So she does not have any palmar drift. So nothing there to be worried about. And then I would also be checking her face for symmetry and to see if she has patent airways like I did earlier. And I'd also be checking your teeth. Can you smile really quick? Your teeth look very healthy and your face is symmetrical and you do not have any dentures. So yes, I believe I got everything for that section. Okay. Next I'm going to be listening for your heart sounds. So there's 5 points that we listen to when we do a head to toe assessment. There is the aortic, which is right sternal border, second intercostal space, and then we're going to do the pulmonic, which is second intercostal space, left sternal border. Then we're going to be listening to the Erb's point, and that is the third intercostal space, left sternal border. Then we're going to be listening to tricuspid, which is left sternal border, fifth intercostal space, I believe. And then, yes, and then the mitral, which is also fifth intercostal space, but it's mid-clavicular line. And that is also where the apical pulse would be counted. So when I do that, I'm going to verbalize that I would listen for a full minute, and you would count that against the pulse that we assessed in vital signs. So I'm going to take my stethoscope, and I'm going to listen to those 5 points. So I'm going to listen to the aortic on this side, on the right side. And I'm going to be listening for S1 and S2 heart sounds, so the lub dub, and I'm going to be listening for anything abnormal, and everything sounds normal. So I'm going to move over to the pulmonic. I'm listening for S1 and S2 heart sounds, everything sounds good. The Erb's point, which is the third intercostal space, left sternal border. I can hear the lub dub, everything sounds normal. Then I'm going to go down to tricuspid, which is the fifth intercostal space. And I can hear the lub dub, but everything sounds normal. And then I would go to the mitral, which is also the apical pulse. It's mid-clavicular line. And I would, if I were to be doing this assessment, I would be sitting here for a full minute and counting and comparing.
Also, it would be like under closed?
Yes, also, so everything sounded normal. And if I were to be doing this in the sim lab on campus, I would be removing the mannequin's Johnny and listening to it against the skin. But for the purpose of the assessment at home, I'm going to listen over her clothing. So I listened to all the heart sounds and assess the apical pulse for a full minute. So next I would anteriorly listen to her lung sounds in an H or a Z pattern. And I'll be listening for anything abnormal, like crackles or rails or wheezes. So when you listen to heart sounds, you're going to do generally 6 spots anteriorly, and then also listening to the right side, the right lateral side, because you have an extra lobe on that side. So I'm going to put my stethoscope back on. I'm going to listen to your lung sounds really quickly. I'm just going to ask you to take a few deep breaths, okay? You take a deep breath? Okay. Another deep breath. Perfect. Good. Another one. Okay. Another one. And then really quick right under here on the lateral side. One more deep breath. Okay. And would it be okay if I listen to your lung sounds on your back really quick while we're here? So when you're listening to lung sounds on the posterior aspect of your patient, you're generally going to be listening in about 10 to 12 different spots, either in an H or a Z pattern. I can't really set up the camera to see, but I'm going to be going from each spot on her back and listening to her lung sounds while she's breathing and listening for anything abnormal. And you generally want to start up high and then go almost all the way down their back to make sure you get the all the borders of the lungs when you're listening. Just a couple more deep breaths, okay? Good. Okay. Perfect. One more. Good. Okay. Everything sounds very clear. Her airways sound patent. I didn't hear any crackles or any wheezes. So your lungs sound good. Thank you for letting me listen to them. And that concludes this portion of the physical assessment, and I will be adding in the third section with the abdominal exam in a moment.